Go.
Hi, I'm Shakiva Loomis, nurse practitioner student, and this is my patient. I have introduced myself to her and got her information. Now I'm doing my hand hygiene, and we're gonna scan the room. And that was what my instruments and standard chart is. Okay, I'm gonna assess the patient, and I'm starting with the skin, and I'm gonna do an overall in every body system. And I'm looking for bruising, color, temperature, texture, moisture, edema, tugger, bruises, nevi, and lesions, and nevi. I'm next going to assess the head, and I'm looking at the color, the texture, and distribution of the hair. I'm going to palpate the scalp, and I'm looking for depressions, infestations, masses, and tenderness. I'm next going to the temporal arteries, and I'm assessing those for tenderness. I'm next going to the I'm going to assess TMJ, where you open and close your mouth. Clench. Okay, go side to side for me. Okay, and there is no tenderness, crepitus, or subluxation. Next, I'm going to assess cranial nerve number 5. Also, clench your jaw for me. Clench your teeth. Okay, and that's the masseter muscle, and there's no tenderness. And that's the motor part of it. The next part of it is the sensory portion, and I'm going to touch her. Face, close your eyes for me and tell me where I'm touching.
Forehead, nose, chin, other chin.
Okay. Okay. And then I'm going to do cranial nerve number 7, and that's assessing the symmetry of her face. Will you smile for me? Frown, poke your jaw, poke your lips, raise your eyebrows. Okay. Very good. Next, we're going to assess her lymph nodes. And these are pre-auricular, and I'm palpating them. Post-auricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. The next thing I'm looking at her ears. I'm looking at the size and the shape of her ears, and then we're going to I'm gonna feel of them, and I'm assessing for tenderness and masses, and I'm pulling on her tragus and pinna. And then I'm going to look in her ear using my otoscope. And I'm going to pull her ear up and back. And I'm looking at the tympanic membrane, and I'm going to do that bilaterally. And I'm looking at the auditory canal. And there's no sign of infection, and the tympanic membrane is gray and concave. The next thing we're going to do is assess cranial nerve number 8. So I'm going to whisper in her ear, and I'm going to assess her hearing. Tell me what I say.
ABC.
Uh-huh.
ABC.
Okay. Next, I'm going to take my tuning fork and assess the Weber side. Tell me if you feel this both bilaterally, both equally. Okay, and I'm testing for utilization. Then this is the Rennie side. And do you hear it?
Yes.
Yes. Okay. And then on the other side, and I'm testing whether air conduction is greater than bone conduction.
Yes.
Okay. And then the next thing we're going to do is I'm going to her eyes. I'm looking at the fissures. I'm looking at her eyebrows and her eyelashes. I'm going to look at her sclera and conjunctiva. And I'm making sure there's no lesions, redness, or discharge. And then I'm going to assess her growth of visual acuity. And I'm going to use the Snellen chart. You're supposed to be 3 minutes away from the patient. And will you read the lowest line? Cover one eye. Read the lowest line.
A, C, D, E, F, G, and H.
Okay.
A, C, D, E, G, and H.
Okay. Very good. So that's 20/20. Next thing I'm going to do is her central and peripheral vision as well. Tell me when you see my hands.
I see
Okay.
him.
I'm coming up on the side. You tell me when you see them.
I see him.
Okay. Very good. The next thing I'm going to do is assess cranial nerve 3, and we're going to look at how your pupils respond directly and consensually. And light should be off, but I'm just going to look at your pupils, and they are direct and consensually responding. The next thing we're going to do is cranial nerve 2, 3, and 6. Will you follow my hand with your eyes? And we're looking at your EOMs. Okay. Okay. Very good. And the next thing we're going to do is I'm gonna take my otoscope and we're gonna look at her internal structures of her eye and the red reflex. And I'm gonna use my hand as a guide, and I'm gonna go in with my, okay, and I'm gonna do it on the other side as well. Okay, very good. And she does have red reflex. Okay, the next thing we're gonna do is go to her nose. I'm looking at the symmetry. It is midline. Put one hand over your nostril and breathe in for me, and the other side. Okay, we check for patency. Close your eyes. We're gonna check your sense of smell. Tell me what you smell. Okay, this is cranial nerve number 1. The next thing we're gonna do is I'm gonna assess her maxillary and frontal sinuses to make sure that there's no tenderness. Next thing we'll do is come out the eye for me. Hold on, sorry. Make sure. I would have a tongue depressor in normal circumstances, but I don't. The eye for me. And then lift your tongue. Okay, okay, very good. And so now I looked at cranial nerve 9 and 10. Her uvula and palate rose with phonation, and her tongue's midline without vascularizations. I also assessed her mouth. I looked at her teeth, her tongue, her gums, her buccal mucosa, posterior pharynx, salivary glands, and her tonsils, and there were 2+ and present. The next thing we're going to do is I'm going to assess her neck. And so I'm going to feel for her trachea, make sure it's midline. I'm going to stand behind her, and I'm going to assess her thyroid, and I feel it. Now, I'm going to push to the side, we swallow. Okay, and I'm push to the other side and swallow. And I'm assessed for tenderness and masses, and there are none. And then I'm going to palpate her carotids. Will you touch your head to the side for me? Okay. And then I'm going to do it on this side. Okay. Then I'm going to listen. I'm going to auscultate her carotid. Okay. Okay. Very good. Now I'm going to assess cranial nerve 11, where you shrug your, and I'm gonna resist against it. Okay, just shrug your lip up. Okay, and I'm push. Okay, very good. And we're gonna do so. Also gonna do range of motion on your neck while we're here. If you flex, extend, hyperextend, side to side, and rotate. Very good. All right, the next thing we're gonna do is her her respiratory system. I'm looking at her chest wall, making sure there's no deformities. And that is symmetric. I'm going to start with the posterior chest wall. We just turn around. Yeah, for me. Very good. And I'm going to feel to make sure it's, then take a deep breath in now. And I'm checking the symmetry, making sure her chest rises and falls equally. And it does. And then we're going to start by doing tactile formitis. Say 99, 99, 99, 99, 99, 99. Okay, then we're going to percuss. We turn around so they can see. Okay, very good. Mm-hmm. Then we're gonna listen. Take a deep breath in and out. Okay, in and out. 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 I'm also going to listen to the lateral lung fields bilaterally. Then we're going to check for consolidation to make sure that she doesn't have any pneumonia. So we're going to check bronchospasm, egospasm, and whisper pectiloquy. So if you would say E for me. E. Okay. E. 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 Whisper E. 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 And then say 99. Okay, very good. Now we're going to assess the anterior chest wall. And if you would, well, I'm going to, again, I'm looking for deformities, make sure it's symmetric. And I'm going to, we breathe in and out for me. And I'm making sure that the chest is rising and fall equally. Then we're going to do tactile formitis again. Say 99.
99.
Say it.
99. 99. 99.
Okay. And then I'm going to listen to her lungs. Deep breath in, and out, in, and out, in, and out. Okay, then we're gonna go to the cardiovascular system. I'm going to listen again to her five heart chambers. And we're gonna start with the right, second intercostal, starting border, and this is the aorta, and then the pulmonic is the second left intercostal sternum border, and then the Erb's point, and then the tricuspid, and then the mitral, which is the fifth midclavicular line. It's also the point of PMI. I'm going to palpate it for the PMI, and I'm also going to listen for a minute for the rate and the rhythm. And then the next thing, I'm going to listen to with a diaphragm and then with my bell. In the same heart chambers, you find. Okay. All right. The next thing we're going to do is I'm going to have you stand up, and we're going to go lay down. Okay. All right. And okay. I'm going to I'm looking. Turn your head to. Okay. I'm looking for JVD. Bilaterally, and then I was assessed for his and list when she laid down. Now I'm going to just palpate those five heart chambers and make for thrills. And then I'm going to go to her GI system. And so I'm going to start by listening. If you come down a little bit for me so I can reflect. And I'm going to look at her stomach, and I'm check the contour and the symmetry of it. And then I'm going to assess her abdomen, and I'm gonna start with the arteries. So this is the aortic, these are the femoral, renal, the iliac, and then the renal, and then the femoral. Okay? And then I'm going to listen to her bowel sounds. Of all four quadrants. Then I'm going to percuss them. And I'm a percussing for tympany and dullness and residency, and it should be tympany unless it's a organ. And then I'm going to go in with soft touch in all four quadrants, and then deep touch, all four quadrants. And I'm looking for tenderness and masses. And then I'm going to palpate her spleen, and then I'm going to palpate her liver. Okay. And then you can sit up on. And then I'm going to make sure she doesn't have any CVA tenderness. So if you kind of turn around, yeah, and then it's fine. Did that hurt? No. Okay. All right. Go sit down. Okay. All right. Then we're gonna start with the musculoskeletal system. Now, so I'm gonna assess all of her joints, and I'm looking for tenderness, redness, swelling, crepitus, deformities, symmetry in all of her joints. And we'll start with her shoulders, her elbows, her wrists, her hips, her knees, ankles, and toes, and fingers. The next thing we're going to do is I'm going to check her strength, test her strength. So will you give me your hand and squeeze it? Okay, strength is 5 out of 5. All right, will you flex your arms, and I'm gonna pull it, okay? And then release your arms, and I'm gonna lift up, okay? Don't let me lift up, okay? All right, then the next thing we're gonna do is your shoulders, where you stretch them out and don't let me pull them, okay? And then close them up, and then don't let me open them, okay? Very good. And then your feet, will you dorsiflex your leg, okay? And don't let me pull them up, and then lift them up, and don't let me push them down. Okay, very good. Will you kick your leg out and don't let me push them down, both of them? Okay, and don't. All right, and then push them back and don't let me pull them up. Okay, very good. Will you open your legs up and don't let me push them in? Don't let me push them in, and then close them and don't let me pull them out. Okay, very good. The next thing we're gonna do is assess her capillary refills, and then in the fingers and the toes, and then I'm gonna check her pulses bilaterally, and these are her radial. And then at the bottom, I'm gonna do her posterior tibial and the dorsalis pedis pulses. Okay. And then the next thing we're gonna do is soft and light touch, upper and lower. So close your eyes. Do you feel this? Feel it? You feel it? Okay. And then the next thing we're gonna do is check vibratory sensation, upper and lower. Okay. I'm gonna do it on her ulna. You feel it? Okay. Yes. Okay. And then on the medialis.
Yes.
Okay. Bilaterally. Okay.
Yes.
And then the next thing we're gonna do is sternosis and graphthesia. If you would, close your eyes, tell me what I put in your hand. What is that?
Ink pen.
Okay. Both hands.
Ink pen.
Okay. And then the graphthesia, what am I writing?
V.
Okay.
C.
Okay. Very good. And then the next thing we're gonna do is her deep tendon reflexes, and so I'm going to get my tuning fork, and I'm going to check her her dorsal brachial radialis, bilaterally. Okay. And then a biceps. Okay. And then triceps. Okay. Her patella. Achilles. And then the Babinskis. Okay. The next thing I am going to do is her range of motion. And so I want you to flex your fingers first. We're going to flex them. Hold them down. Your fingers. Flex. Flex. Extend. Hyperextend. Out. Abduct. Abduct. And then thumb opposition. Thumb opposition. And while we're here, we're going to also do finger to finger. Finger to finger. And then we'll hand flap in your lap. Okay. And then take your finger and touch my finger. Okay. Okay. Other hand. Okay. Okay. Alright. Very good. That was just checking her coordination. The next thing we're gonna do is range of motion of your wrist. So we're gonna flex, extend, hyperextend, ulnar deviation, radial deviation, and rotation. No, rotation. Yeah, very good. Next thing we're gonna do is flex your elbows, extend, hyperextend. And then we're gonna flex your shoulders, extend, hyperextend, adduction, internal rotation, external rotation, and circumduction. Okay, very good. And then your toes, you're gonna flip them up. You're gonna lift, and flex and extend, regular and hyperextend down. Open your toes up, your toes, not your feet, your toes, and then close them up. Okay, and then your ankle, you're gonna flex and extend, dorsal plantar, and then you're gonna everse in, everse out, and then rotate. Not your body, just your toes. Okay, yes, just flex. Okay, and then stand up for me. We're gonna do your knees. We're gonna flex, extend, hyperextend. Of each knee, flex, extend, hyperextend. Flex, extend, hyperextend. Both knees. Okay, flex. Okay, and then we're going to your hips. Flex. Come on, do it with me. Flex, extend, hyperextend. Flex, extend, hyperextend. Okay, we're going internal rotation, both of them. External rotation, kick out, kick out. Okay, circumduction. Okay, inversion. Internal rotation, external rotation. I'm sorry. Okay, very good. And then next thing we're gonna do is bend over, and I'm gonna look at your spine and make sure there's no curvature, no problem, no scoliosis. You can stand back up, and then you bend back, and then up, side to side, and then rotate. Okay, very good. Then we're gonna do you're gonna do close your eyes and stretch your arms out and close your eyes. And close your eyes. Okay, that's a normal Romberg's test. Now walk forward. Okay, and then walk backwards, heel to toe, heel to toe, heel to toe, heel to toe. Okay, do it again for me. Just come back. Heel to toe, heel to toe. Very good, very good, very good, very good. Okay, and then one leg up and jump up on one leg. One, and then do the other. And this includes my assessment.